Okay, we're gonna start this slow. What is your name and profession?
Sunita Bhatia, and I'm a general dentist in Ottawa.
And how many years have you been practicing for?
Over 25 years. I know, crazy, right?
Where did you go for undergrad?
University of Manitoba.
Where did you go for medical school or dental school?
University of Manitoba.
Did you take any gap years before going to dental school?
Not before dental school. I took a gap year after high school. Best thing I did. But I don't think it was intended for like a gap year. It was an opportunity. So I took it. I don't know if it helped me or not, but it was after high school and then zero gap year.
Do you remember what your favorite part of dental school was?
I think clinical. It was the fourth year where you're all comfortable and we were treating patients before, but we were a little bit more comfortable, I think, in fourth year and kind of more on our own. So fourth year was definitely the best.
And what specialty did you think you were going into on your first day of dental school?
General, pretty much where I am.
Were there any specialties you knew right away that were not for you?
Probably, although I love doing root canals, I don't know if I could do them all day long. So definitely not root canal, not as an endodontist.
What made you fall in love with your specialty?
General, you know what? It's the socialization. Love the socializing with the patients. So dentistry itself, yes, the treatment, but I think overall it's the one-on-one with the patients.
Now, how long does your training take after dental school for those that want to be in your shoes one day?
After dental school, once you graduate, you're on your own. But I do recommend associating somewhere first, having a good mentor. That can make all the difference.
Did you ever consider any other degrees?
Let me think. No. 7 years of school, university, that's pretty good.
What would you say is the most unique part of your specialty?
Of the actual dental part? Well, I think the uniqueness is that we are private. So it's almost like you're running a business. Now, unfortunately, you don't get too much training on the business aspect. And that was a learn as you go. And I ended up, I don't know, I think I have a little knack for it too. You don't really realize it until you do it. So I do like running the business aspect, although the clinical is still my favorite, but you need to know a little bit of business too.
Why should someone choose your profession?
Because it's awesome. But besides that, I think it's awesome, but I think the hours are great. You do have to be a social person for sure. And lifestyle, and I'm not talking about standard of living. I'm just talking about you can set your own hours eventually. You know, you can do the procedures you want. There's always specialists. If you can't do the root canal, you can refer. So in that way, I think you get a lot of flexibility.
And now following that question, why should someone not choose your profession?
It's a lot of school. And it's challenging. So I think the schooling was more challenging than actually practicing. Whereas for some professions, it might be different. But if you can get through that, you're on your way.
Are there any stereotypes for being a dentist?
Lots. Where should I begin? Yeah, people are scared. As soon as they come, they're scared because it's pain. It's only after treatment they realize, it doesn't have to be painful. It doesn't have to be an unpleasant experience. Don't only come when you're in pain, right? There's a maintenance. And so I think that's a big one. So I have a lot of patients that are scared and I have to reverse that feeling. So that can be challenging. The stereotype, we make a lot of money. Well, it costs a lot too. It's not like any other profession, but our equipment, our material, it costs a lot to be a dentist too. So I think people should take that into consideration too.
What does an average day look like for you?
It's busy. I think as soon as I come in, there's staff questions, things I have to address with running the clinic, with the actual business part, whether it's computer, whether it's front desk, whether the x-ray's not working, building issues. We deal with that first. And then once you get into the dentistry, then you have to have almost like two different heads, One is the clinician. So you have to focus on what the patient wants clinically, but then you're also taking care of the office, running of an office. So it gets busy. So I'm here before the patients. I start with the patients, of course, and then it's actually a little fun during the clinical hours. Then after that, it's rounding up, cleaning up, doing parts, finishing up.
Okay, and how many patients do you see on an average day?
I would see directly under me, it could be 8, 10, 12 patients, okay? Because I like to use more than one room. But if you count the patients that I see that are getting their cleanings done, so it could be from and you can add another 20, 30 patients to that.
Wow. And what is the most amount of patients you've ever seen in a day?
Oh, in my column, just coming to see, I think it was 15, which is a lot for us because we're actually hands-on. You know, it's not like, okay, diagnose you later. The patient knows they broke a tooth. They're not here for me to tell them they broke a tooth, right? They want to get it fixed. So I do keep that time to do the filling when they come for that procedure. Bigger procedures, I'll have to tell them to come back. And there are times where it's an infection. You have to give antibiotics. It's short, or their emergency is not as big as they felt. But for broken teeth or certain things like that, if you can fix it on that day, that is the best way to go.
What is the hardest procedure you've ever had to do?
That's a good one. I wouldn't say hardest. I think a challenge in which I take pride in. Actually, I took it as a challenge, like a full mouth reconstruction. And so I worked with multiple disciplines, like implant. I worked with my lab. I worked with the oral surgeon. So basically, a person with broken teeth or infected teeth, and they're a little crooked and whatnot. So she wanted a whole new look. So it was hard. It was challenging, but it was probably most gratifying.
And following that question, what is the most common procedure you do on a day-to-day basis?
Fillings. But I mean, yeah, that would be the most common. I don't think there's a day where you don't do a filling, but there are other common ones like crown and bridges, root canals, but yeah, fillings for sure.
What is the most memorable case you've ever encountered so far?
Memorable case?
Yes.
Actually, it was like when I think it was one of my first or second year, and it was a young girl who lost her front teeth, and she was and I know she couldn't afford it. So those are the most memorable. So I major discount, but I restored the front teeth for her because she was wearing a denture. She was being made fun of at school, and we made a bridge for her so she doesn't have to take it out. Really nice aesthetically. It ended up being a really nice case, but it was really the effect it had on her. That was amazing. So I still remember that. It was my second year out of school.
And what is the most rewarding part of your job?
See, I do a lot of ortho too. I do a lot of braces and that's the most gratifying. But it could be many ways. And there's one, I think I had an older lady, and she was someone's mom. He had brought her in, and her tooth was hurting, and it was an easy extract, like no brainer. Come in, okay, I'll just take it out, and no, like it didn't even take an effort. But I think like a few months later, he goes, I'll never forget what you did for my mom. So I was like, well, it wasn't even a big deal. You had a loose tooth, I took it out. But you don't see the agony that they're going through, and they don't know what to do. And finally, when you see a loved one out of pain, it makes a big difference. So it is satisfying when the patients will come back to you and tell you you're appreciated. It's nice.
Now, what would you say is the toughest part about your job?
It's management. Definitely management. So again, it's that business side, taking care of staff, right? You're working with different personalities. You're working with patients. They have personalities, but that's in your, it's your forte, right? It's what you do. It's what we're trained to do. We don't have training in business. We don't have training in staff management, and that you learn as you go. So that's always the challenge. That's always the toughest part, but it's nice to have your own business too, though.
And how many hours do you work in an average week?
24 to 28. Pretty nice, huh?
Yeah.
I work 6-hour shifts.
Okay.
But okay, that's pure dentistry though. But then there's an hour before, there's an hour back, then there's the business part. But pure dentistry is 6 hours a day.
It adds up.
Yeah.
And what time do you normally wake up at?
So I have 2 different shifts. So if it's a morning shift, I start at 8, I'll wake up at 7. But if it's an evening shift and that starts at 2, then I'll wake up comfortably at, slowly 8:39.
And for your shifts, what time do you leave your practice at?
For which one, sorry?
For both shifts, what time do you leave work at?
Oh, okay. So I'm a night person. So my nighttime, I will do all my charting and whatnot. So it can be as late as 9:45, and I have no problem doing that. Okay, I'll finish at 8:30, and if I have a lot of work to do, I keep it for my night shift. Daytime, I like to leave right away, only because, especially in the summer, you want to enjoy the day.
And how many hours of sleep are you typically working with?
I think I only need about 6 hours. I don't need that much sleep.
You've kind of already answered this, but how long does it take for you to chart at the end of your day?
It depends. So half an hour to an hour.
And who are you most thankful for on your care team?
Oh, okay, that's a tough one. On my team, well, first of all, my assistant, like she's with you, like your husband, you know, like she's my so, and actually her job is to, I wouldn't say take care of me, but make sure everything runs smoothly. And if they're not there, you see it, you feel it, right? You're a little lost. So definitely, if I had to pick one person that I appreciate more, or that is a necessity, it would be your chairside dental assistant.
And what is the most common dental advice or tips that you give to your patients?
Typical. Typical, brush 2 times a day. But I do emphasize that it's the nighttime brushing that's really important, because you're removing all the food that's been there all day long, right? And then you're just sleeping through it. So that I do emphasize, but that's the most common tip I give them.
Great. And what is your favorite thing to do when you are not working?
Travel is a big one. But locally, I mean, I think so. I do dance. I'm a trained dancer, so I find that whenever I go to dance class, whether I'm tired, I'm in a bad mood, whether I'm sick, I know scientifically doesn't even make sense, but after class I'm just better. Like, for sure the mood and stuff, but I even, like, I've been sick and I'm better. So dance is definitely a big part of my life, so that's for sure.
And can I ask what type of dance you do?
East Indian classical, so it's called Kathak, but I'm trained in Bharatanatyam too, so there's 2 types.
And how do you balance your work and your personal life?
Time management, man. That is the key to success. I'm telling you guys all that. Time management, whether it's university, whether it's like just staying at home, being a mom, like a homemaker, or professional. Time management is the key.
And what's the weirdest medical question or advice a family friend has ever asked you before? I know as a medical professional, you get questions about people trying to, you know, dump their issues onto you. So what was that? What does that look like?
Ooh, that's a tough one. The weirdest?
If not the weirdest, just a common one that you get from friends and family.
Oh, what's his dot? What's his dot? I'm just like all the time. Do you see his black mark? I'm like, oh my gosh, it's tartar. On top of that, you need a cleaning dude.
And how do you manage being both a medical professional and a business owner?
It's tough. Well, it's not tough, but you have to compartmentalize. You can't let business mix in with healthcare. So I'm a big supporter of that, because I can't let treatment or diagnosis be affected by, you know, costs and things like that.
So it's kind of like a medical professional first and a business owner second, or?
Well, you have to be, because that's my first, okay, right? The care for the patient, and it can't be driven by business benefits. You know, like, we need to build this much. We need to, you know, to make. I don't believe in that. So that you have to keep that very clear, especially in a profession like dentistry, because we are it's so mixed. It goes hand in hand. Yeah, you have to take care of your business because we are private. So we're working with insurances and we're working with patients paying, right? So who's getting a discount? Who's things like that. You have to, but you can't let any of that influence your treatment.
On another note, do you have any pets?
Not a pet person at all. Sorry, no. I appreciate them from afar, but no.
Do you have any favorite dish to eat?
Okay, so my favorite food is Indian food and Thai food. Those are my 2 favorites. So I think my go-to is like tandoori chicken. It's so basic, but it just is.
Do you have like a go-to spot, or?
Oh, is this advertising for someone? You know what? Well, there's a really good restaurant in, there's so many. I like the canteen type, you know, like not really the restaurant. Which one did we go to? What's it called? It's way in, I'm thinking. Well, the one in Orleans, there's a really good one, Rangoli. I have to say, really good dishes.
Okay, I'll be sure to check it out. If you could have dinner with anyone in history, who'd you want to have it with? Any person in history, alive or dead.
Okay, it's gonna be cheesy. My father. Seriously, actually, so I owe a lot to him. Okay, I mean, he supported us through school. He's the one who got us here. But he has, like, just talking to him, you can just learn so much. Like, he's just like this chest of wisdom. So I don't need to go any further than my father.
That's really nice.
Yeah.
Do you have any artistic hobbies you keep up with? I mean, I guess other than dance.
Other than that's the big one. It actually
Okay.
takes up a lot of our time because I also teach now. So like, I mean, there's teaching, and I take more of a role in like putting up performances and things like that. So I help backstage, and so it's not just dancing myself, but it's also helping others too. So
How much water should you be drinking every day?
me personally, a lot. Don't ask the next one, how much water do I actually drink? Let's try with the 8 glasses. I drink maybe one. Maybe.
But like to recommend to people like a healthy.
Oh, I thought you were talking about me.
No, no.
Okay, no, but 8 glasses of water.
Okay. Favorite sport to play and or watch?
Okay, to watch tennis. Definitely tennis. And no, I love watching tennis. But there's other ones too. I like football. I like Super Bowl for sure. And to play, I'm not a big sporty person, but you know, I'm trying golf a little bit, and I'm trying and I can hit the ball a little bit for tennis. More of racket sports.
What's the best way to relax after a long day?
Go for coffee. Go grab a coffee. And I do that. Right after work, me and my husband will go for coffee, coffee house, for sure.
Are you more of an introvert or extrovert?
What do you think?
Extrovert.
Yeah, totally.
Following that, do you think personality plays a factor in your practice?
Huge. That's what I said. Like, you need to be a people person for dentistry. Like I said, they're all, majority of them are scared, or, you know, it's that stereotype. So you need to relate to them for sure.
What did you want to be growing up?
A cashier. A cashier at, I don't know why I wanted to be a cashier. And I was actually, and then that was that.
If you were doing dentistry, what would you be doing right now?
You know what? I could have had a profession in dance. I could have opened up my dance school. That was the other alternative.
If you could change one thing about the dentistry field, what would it be?
Oh my gosh. If we could have something else rather than freezing needles. If I could change that.
Like a non-pharmacological intervention?
Like replace the needle with something, because that's what most people are scared of. That's why they probably don't even come.
If you were to go back and change one of your experiences that you had when you were younger, what would that be?
Good one. I had a really good childhood. Touch wood. Yeah. An ex-boyfriend. That's about it. But childhood was, like great memories.
What can medical students do right now to prepare for the specialty?
Well, I find now, like, I think you have to explore outside of just studying too. Like, studying is a must, but I think they're looking for more all-rounders, right? Sports, and you got to look for something, I think, unique. I think they're looking for uniqueness. So, you know, you have the standard, you do have the labs, you work in a lab, you're doing, like, scoring well on your exams, but something, I don't know, dance for the king or something.
And where do you see your practice going in 10 years?
In 10 years? How about we say 5? In 10 years, it'll still be standing. I'm not sure if I'll be there. But right now, at this time, first of all, we're modernizing, so it's going to be a little bit more tech, I think. But in 5 years, I might slow down, but I can't ever envision myself not here. I can't envision it. So I'm thinking, even if I came in to do some, I don't know, sorting out charts, I don't know, just can they hire me to do something if I can't do dentistry anymore?
That's great. Are there any shows you're currently binging right now?
Okay, so I'm a Bollywood fan. What can I say? So there's like Bollywood series, Delhi crimes. I love like crime documentaries, and yes, I do watch the Kardashians.
Who was your biggest supporter during your dentistry and just all of your education?
Influence, I would say, like, was my father, right? Guidance. Supporting was my mother. Okay, her was just, I'll do everything for you, just do well in school. And she really, like, yeah. And it was true, and I tell my kids the same thing.
What's one myth about dentistry you wish more people understood?
I think sometimes maybe people don't understand the importance of good oral health and how it affects the rest of the body. Like there's already studies with heart disease and oral health. There is a link, and I don't think a lot of people really understand that. They think it just ends with cavities. Brush your teeth so you don't have cavities, but it's not. It's the health of the gums that I don't think they're really aware of and how it affects the rest of the body. So
If you had a day off with zero responsibilities, how would you spend it?
that's a good one. Okay. Zero responsibilities. Shopping is a good one. It's just relaxing. It's not about spending money. It's just about relaxing, going for lunch, socializing. And I always pictured it a nice summer afternoon, like hot, warm.
Do you think AI will be able to take over your field in the future? Like, is your field AI proof?
That's a tough question because there's so many things AI can do that I would never even think of. So I can't imagine them. Okay, I get the diagnosis, but I'm looking at robots drilling and whatnot. But you're missing that emotional factor, and I think, well, in any health profession, I think that piece is really important. There's no empathy. Where's the empathy? You need to have that. You got to sympathize. You have to empathize. You have to. So I can't see AI providing that yet.
How did COVID-19 affect your practice?
Oh, it changed a lot. I think we were always, when it comes to infection control, we were always up there. That it didn't affect infection control, meaning, like how barriers and sterilizing, because we had to do that anyways. But I mean, COVID-19, there was a lot of people talking about like transmitting diseases through sprays, so people were a little worried. But personally, it was more, I mean, we were off for three months. I was lucky I was in a good stage in my career. I wasn't just starting, but I'm not near retiring either. So I was able to afford the 3 months off. And then we had to, rearrange the schedule so there's not too many people working together. And actually that kind of took off. Like it just kind of stayed that way. We kind of liked it. And we ended up opening 12 hours a day rather than just the 8-9 hours a day. So now we're open 12 hours a day, every day, except for Friday.
How do you deliver bad news to patients?
Well, you have to be sympathetic, but I think direct is the best approach. Don't, beat around the bush and don't sugarcoat it. This is what it is, but present them a solution. The worst news, you're gonna lose a tooth, or you're gonna, or okay, it could be cancer also, but you have to be direct.
What are benefits of owning a private clinic?
Well, we're not governed, we're not influenced by the government, right? So when I say we, I mean we are governed by a college, okay, but we can make our own fee guide, right? We make our own rules that govern dentistry, so we don't have to follow to a certain degree. It's just self-governing is a lot better.
What's the first thing you do when you wake up?
I need my tea. I need my morning tea. Brush your teeth, tea.
What's a quote that you live by every day?
Always reach for the moon, because even if you fail, you'll land among the stars.
That's a good one.
Always. I've always followed that.
Do you have any hidden talents?
Gosh, I'm so outward. I don't. Let's see something they don't know. If I have a talent, everyone knows about it. So, no.
How many languages can you speak fluently?
Fluently? 1, 2. So English, Hindi, and I would say French. Although my dental French is a lot more fluent than my conversational French. But you ask me a root canal in French, beginning to end.
What motivates you?
I don't know. Just, just feeling alive. Like, I think the more you move, the more alive you are. Like, just making a difference, making what I do count.
Has your definition of rest changed over the years?
Of rest?
Yes.
Taking a pause? Let's see, my definition of rest. No, I think, I think as I'm growing older, I'm going even faster. It's weird. So maybe like that is a change in definition. Like, I like being busy. But maybe that gives a little calm. I don't know.
What's the worst thing you can do for your teeth?
sticky sugars. But it's not the worst thing. But you got to watch the acids, like anything that gives that provides acid. But there was a huge trend with water and lemon in water, and it's great, but great for the body, they say. But we had to advise a lot of patients that it's just too much. It's wearing the teeth. So, yeah, anything to do with acid, and people don't really realize. But
what is your opinion on teeth whitening?
go for it. But there's a lot of products out there which are just, it's like taking your money in the garbage, right? But there are some work, like Crest White Strips. I've seen them work, and I think it promotes confidence anyway. So it's kind of nice. And the whiter your teeth are, the cleaner they look. So it's nice.
Early morning shifts or late night shifts?
Oh, late night for sure.
Stay in or go out?
Go out.
What is your favorite place that you've been to, that you've traveled to?
I love Asia. So yeah, like Thailand, Hong Kong, anywhere Asia. I mean, I'm from India myself, so but that's different because there's family and whatnot. But I just love the Asian culture.
What is your dream car?
I'm driving it.
What's one piece of advice you would give to students trying to pursue a career in dentistry?
Well, first of all, don't give up. Like that, you have to be focused. And again, I think my biggest asset was time management. It really helps. And I tell my kids that too. Like when you go to university, you got to manage your time, because to go into medicine or dentistry, you have to do multiple things. Like you just can't study, right? You're involved in so many things, and you can be happy about it. And whatever, it could be a struggle, try to enjoy it. I know it's hard to understand, but try to find the joy in, okay, I have to do all these charts. I will try to just enjoy what you're doing. Enjoy the studying, meaning, you're also meeting other people, like socialize a little bit, but focus when you're studying. So, but time management is a big thing.
Thank you for your time, Dr. Bhatia.
Thank you. This was great.